I want to wish everybody a good afternoon on this beautiful day in Erie, Pennsylvania. Just think, a week ago it was snowing. So what a beautiful day. We want to welcome you to the Hamot Health Foundation Board of Corporators Spring Meeting. My name is Jim Orn, and I have the privilege of being the chair of the Board of Corporators. Over the years, we have been hosting this event at a number of local venues. And this year, we're pleased to be here at the Erie Art Museum. It's a beautiful facility, and we're glad to be here. We do recognize the importance of supporting other nonprofits and encouraging economic development in our community. At this time, I'd like to ask you to please stand if you're able and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You may be seated. I first want to thank the Board of Corporators for your continued engagement and support. I also want to extend my appreciation on behalf of the Board of Corporators to UPMC Hamot Board of Directors, the leadership team, the medical staff, employees, and all the volunteers here today. Your many efforts make UPMC Hamot an incredible and top-quality organization. Welcome to all the representatives from UPMC who are in attendance today. I also recognize those from the region, including representatives from Kane Community Hospital, WCA, Corey Memorial Hospital, and our partners from the Shriners Hospital for Children. And finally, I thank government officials and their representatives for joining us on a busy time of year for them, in addition to other members of the community and the media. With that, the next item on the agenda is a Hamot Health Foundation update. Now I invite Ann Beulah, President of the Hamot Health Foundation and Chief Development Officer at Hamot, UPMC Hamot, to please come forward. Ann?
Thanks, Jim. It's a pleasure to be here with you, and thank you all for joining us. Leadership is the theme of today's meeting, and it's one that resonates with me as I've spent the last 6 months getting to know the UPMC Hamot leadership team and the energetic and innovative physicians, staff, and volunteers who make the culture here so unique. Each one of us is here today because we're committed to the success of UPMC Hamot and to the belief that our community deserves local access to the most advanced health care. Everyone here is also a leader, contributing not only our time and talents, but also supporting the vision of UPMC Hamot as a benefactor, champion, and ambassador. For over 30 years, Hamot Health Foundation has been a vital part of the path to success for UPMC Hamot, laying the foundation for new construction projects, new equipment, and new levels of care. Today, I'd like to thank the members of the Board of Corporators for their commitment to walking this path with us and show how contributions over the last year have paved the way for some truly monumental accomplishments. This year, over 1,500 donors have contributed more than $2.1 million to the foundation, allowing us to in turn fund the following: the opening of Wayne Primary Care, a new school-based healthcare center that brings physicians and state-of-the-art healthcare to a neighborhood where children and adults live at or below the poverty level. Nearly 600 patients are already enrolled. The construction of a new atrium and lobby, which would transform the entrance into a more inviting and comfortable space that symbolizes the sophisticated care available at UPMC Hamot. Construction on the project will begin later this year. This was made possible by a $1 million pledge from Suzanne and Bill Connor and a $750,000 pledge from the Hamot Aid Society. I'd like to thank them both for making this possible. Funding also is making possible for the relocation of the pediatrics unit to the Women's Hospital to improve the experience of the patients and their families. This will also bring the pediatric specialists under one roof. And there's also ongoing education, training, and research, including UPMC Hamot Research Days, the PCA Retention Program, annual nursing scholarships, and continuing education for nursing, administration, and other staff. Funds have also been established through the Hamot Health Foundation offering ongoing programming and support, including Lucy's First Step Fund, which offers private and group counseling to parents living with the overwhelming loss of a child. They raised over $17,000 during their inaugural golf outing. Then there's the Guardian Angel program, which provides an opportunity to say thank you in a special way to doctors, nurses, and healthcare professionals who deliver expert care by making a gift in their honor. We've raised over $60,000 from over 800 donors. While events like Bright in the Night raised over $30,000 to support Great Lakes Hospice, and the annual Hamot Health Foundation Gala in January created the John T. Malone Legacy of Leadership Fund, which will develop the next generation of leaders at UPMC Hamot. More than 600 attendees made this our largest gala to date, and we raised over $90,000. As members of the Board of Corporators, many of you have contributed generously to support Hamot Health Foundation. 121 corporators have contributed over $80,000 this year to the Next Generation Fund. As you know, our goal is $150,000, and we still have a long way to go. To recognize those of you that have made a contribution to this year's campaign, we've placed a gold star on your name badge, and we'd like to thank you for your continued support and for your generosity. Momentarily, you'll hear from this year's campaign chair, Lisa Watkins, as she shares with you how your contributions have and will make an impact. Now I'd like to take a moment to recognize the time each of you has put into being an active member of the Board of Corporators, especially our officers, Jim Orn, Lisa Watkins, and David Zimmer. I'd also like to take the opportunity to thank members of the Hamot Health Foundation Board and the UPMC Hamot Board, and also the Hamot Aid Society. Without their continued support and generosity, we wouldn't be able to do what we're able to do. Today, you'll receive a pin signifying that you're a corporator of the Hamot Health Foundation. It's given in gratitude, and I hope that you wear it proudly to Corporator, UPMC Hamot, and community events. Again, thank you for helping Hamot Health Foundation pave the way for outstanding health care in our community and the ongoing success of UPMC Hamot. It's an honor to walk this path with you. Thank you.
Thank you, Ann, for that update. And now to provide an update on the current Corporator campaign, I now invite Lisa Watkins, our campaign chair, to the podium. Lisa.
Thank you, Jim. The Board of Corporators is currently in its second campaign year for the Next Generation Fund and continues to support healthcare career opportunities for our community's youth through education and scholarships. To date, the Next Generation Fund has sponsored Mercyhurst Northeast Health Explorer Camp, Health Occupation Students of America, prep student Daniel Macaluso attending National Student Leadership Conference at Harvard Medical Center, Fort LaBeouf student Caden Gilson attending University of Pittsburgh Healthcare Career Scholars Academy. The fund also supports K-12 healthcare career program led by Denise Mosley. This program is part of UPMC's Center for Inclusion that provides students with field trips, mentorships, job shadowing, and other opportunities to learn about healthcare careers. On May 30th, for the first time, 75 high school juniors from Erie School District's Go College program will attend UPMC Hamot's Fast Track to Healthcare Careers. At the event, small groups of students will hold 10-minute reverse-style interviews with more than 40 UPMC Hamot professionals. Imagine speed dating. Fast Track provides a unique setting for students to explore healthcare careers, understand the importance of education, and improve communication skills. As you can see, the Next Generation Fund is already impacting young minds in our community. In 2012, the first year of the campaign, we raised $106,000 from 134 donors. Our goal this year, as Ann said, is $150,000 and 100% participation. Unfortunately, we have not made this goal. To date, we have raised $80,000 from 121 corporators. That is only 38% participation. I would like to thank the corporators who have contributed to this year's project. These individuals have a gold star on their name tags to be recognized tonight. If you have yet to make your pledge, please feel free to speak to myself or any member of the Hamot Health Foundation team here tonight. The Hamot Health Foundation believes in the Next Generation Fund so much, they are committing $300,000 in support of it. On behalf of the corporators, I thank you. I would now like to invite Elaine Stanton, co-director of the Mercyhurst Northeast Health Explorer Camp, to please share with us how the Next Generation Fund is impacting their organization. Thank you.
Good afternoon, everyone. Thank you so much, Lisa. I am Elaine Stanton, and I am the co-director of Mercyhurst Northeast Explorers Camp. Mercyhurst has realized over the past 6 years that the university just couldn't just sit back and wait for minority students to supply and show up at their doors. It just wasn't going to happen. At least not to the extent that the minority community deserved it to happen. Mercyhurst is, after all, an opportunity university that offers youth and adults the promise of a 2-year career. So the Nursing and Allied Health Division of the School of Health Professionals of Public Health began offering a week-long Health Career Explorers Camp to middle and high school students that will give them a hands-on opportunity to explore 6 different healthcare careers. And during this week of camp, we informed them the importance of taking maths and sciences in high school. And we give them the opportunity to practice healthy lifestyles, and we also give them a $2,000 scholarship upon completion of the week-long camp. And this scholarship will allow them to attend Mercyhurst University in their allied or other programs that they have at the university. Over 400 students have attended, and now we are beginning to see the results of the allied health programs among our local universities. Our campers, they love, as you can see on the pictures, they love to come to UPMC Hamot for their field trips. They are so happy and they are so gratified with the experience. The Hamot Health Foundation has co-sponsored this year's 50 students. We're looking at 25 middle school and 25 high school students that will attend the camp this year. This opportunity is a win-win situation for our students, for the university, and for Hamot, UPMC Hamot, and for the entire Erie community will benefit from a culturally relevant and diverse healthcare workforce. So thank you so much for your contributions. Thank you.
Thank you, Lisa and Elaine, for bringing us up to speed on these great programs that are being offered. And now I have the privilege of inviting Mr. Scott Kern, Chair of the UPMC Hamot Board of Directors, to provide a board update. Scott?
Thank you, Jim. And given the weather today, thank all of you for coming here. I have to admit, when I was outside earlier, I was hoping attendance would be good, and it is, but the weather is always a battle, particularly when it's the first And if you look at the weather report, there's not a whole lot of more to follow. A nice day in a while. But thanks as always. I'm grateful for the opportunity to address the Hamot Health Foundation Board of Corporators. And first, I'd like to extend my appreciation for all of our corporators for your ongoing support. I'd like to thank Corporator Chair Jim Orrin, Vice Chair Dave Zimmer, Campaign Chair Lisa Watkins for their leadership and service to the Hamot Health Foundation over the course of the year. Thank you very much. I enjoy the update very much on the Corporator campaign. I have to be honest with you, full disclosure, I went like this. Ooh. So we're off to a really good start. I would like to commend Hamot executives, physicians, employees, and volunteers for the countless efforts that result in high-quality, compassionate health care. Last year at this meeting, an important announcement was made that made Jim Fiorenzo John Malone's successor as UPMC Hamot's next president. So on behalf of the UPMC Board of Directors and the UPMC Hamot Board of Directors, I would like to thank Jim. Under his leadership, Hamot continues to adopt innovative ways to advance care quality and serve the patient. So Jim, good job. Thank you. Jim's going to be speaking in a little bit, and he's going to talk about what's going on in healthcare and, of course, what's going on at Hamot. And my comments are going to be more, I'm going to talk a little bit about a community benefit, the community benefit that Hamot brings to this group and to the whole region. If asked to define the role of a hospital in our communities, most would point to the medical, surgical, sometimes rehabilitation or behavioral and emergency services expected of hospitals. These essential services represent the core of caring that is delivered by community hospitals. Hospitals, however, go way beyond these essential medical services to help improve the health of communities, fulfill their charitable missions, and demonstrate good corporate citizenship. Hospitals and health system programs and services that address identified community health-related needs, regardless of the source of availability for payment, and are intended to improve access to health care, health status, and the use of healthcare resources. The key is that these programs are accessible to the entire target community regardless of the ability to pay, and likely would be discontinued if decisions about them were based upon financial considerations. I'm going to talk a little bit about some things that are going on at Hamot and some initiatives that are going to be unrolled. Hamot's Community Benefit Program fundamentally is built upon the charitable mission to provide care to all. In addition, UPMC Hamot subsidizes several health organizations throughout the area to ensure high-quality continuum of care, and also has in place numerous programs designed to advance the health of our community. On a yearly basis, the organization conducts numerous free screenings, health screenings, that serve more than 7,000 individuals. We support the City of Erie, its schools, police and fire departments, Erie County, and numerous nonprofit organizations. UPMC Hamot partners with Erie organizations, the government, and its citizens to ensure safe, high-quality neighborhoods. UPMC Hamot is a vital member of the community with more than 3,400 employees and an annual economic impact of $481.8 million. In fiscal year 2012, UPMC Hamot reported more than $27 million in community benefit. Also in fiscal year 2012, UPMC Hamot reported $36 million in uncompensated care. We're projecting uncompensated care to reach $49 million at the end of the fiscal year 2013. Unfortunately, the significant increase is indicative of a growing indigent population in Erie. It's important that Hamot continues to establish new ways to meet community needs. In 2010, IRS guidelines were changed, and they now require all nonprofit hospitals to conduct a community health needs assessment at least once every 3 years. Through our affiliation with UPMC, Hamot partnered with both the UPMC and University of Pittsburgh Graduate School of Public Health to conduct community health needs assessment and develop an implementation plan. Our Community Advisory Council is comprised of UPMC Hamot Board of Directors, UPMC Hamot Board of Directors, and community guests. And those guests include David Dowsey of Mercyhurst University Institute for Public Health, Johnny Johnson from Erie Voice, Rochelle Kowinski from LifeWorks, and Tony Snow, MD, from Community Health Net. This advisory council worked with the UPMC Hamot leadership to identify and understand our community's healthcare needs and address how UPMC Hamot can more effectively implement solutions to decrease our community's growing health issues. Our community health needs assessment identified 3 areas of the most concern: preventative screenings, prenatal and maternal care, and end-of-life care. These are areas where resources and services are most needed and impact is most beneficial. UPMC Hamot is committed to initiatives that address those that will improve our health, the health of our underserved communities, and achieve measurable results. Preventative screenings. These will help identify some of the leading causes of death at early stages when treatment is likely to work best. UPMC Hamot is going to be collaborating with community partners to target populations and improve access to screenings that provide early identification for many health issues such as cancer, heart disease, diabetes, and stroke. Prenatal and maternal care. Unfortunately, Erie County's infant mortality rate is high compared to the state and the nation. The area also has a higher incidence of unhealthy behaviors during pregnancy, such as smoking, which are associated with poor outcomes. UPMC Hamot maternal and infant health and prenatal care experts will be identifying and working with current community programs to find ways to better incorporate a variety of initiatives, including nutrition and healthy eating, exercise, preventative health and wellness, and screenings. End-of-life care. Almost 2/3 of the deaths in Erie County result from chronic disease. Also, the number of Erie County residents older than 85 has increased since the year 2000. UPMC Hamot has existing programs that address aspects of end-of-care life, but there is significant potential to leverage community partnerships to enhance programs in this area and improve the quality of life for our aging population. We're in the initial phases of the formation and implementation of these processes, and we'll keep you informed of these exciting community initiatives as we progress. UPMC Hamot is also participating in the Erie County Community Health Needs Assessment and has partnered with Erie County Department of Health, Corey Memorial Hospital, Mill Creek Community Hospital, St. Vincent Health System, the Erie Community Foundation, Highmark Blue Cross Blue Shield, Community Health Net, and the Northwest Pennsylvania Area Health Education Center to evaluate the health status of Erie County residents, identify concerns, and provide areas of focus for collaborative action within our community. The community needs it. Well, I hope you enjoy the rest of your day. That concludes my comments, and you can see there's some great things coming to the community. So with that, Jim, I'm going to hand the ball back to you. Thank you again for your support.
Thank you very much, Scott, for that information. Now I have the privilege of introducing Jim Fiorenzo, UPMC Hamot President, to provide an executive update. Jim?
Thanks, Jim. I think the weather is because of me. Every time we have a party, right? First of all, I want to thank everyone for coming today. A year ago and a day, we were down at the Maritime Museum, and I was announced as the next president of UPMC Hamot, and I was obviously very pleased to take that opportunity. But I also want to thank our leadership team, the board headed up by Scott Kern, the confidence from the UPMC management team headed up by Leslie Davis, who I work with on a regular basis, and also my executive team, who's been very supportive of me this past 10 months. We've had a challenging 10 months, but I've been very excited to come to work every day to meet the challenges of delivering quality health care in Erie. With that, I obviously want to thank Jim, but I also want to thank the Hamot Health Foundation Board of Corporators for being committed and important voices in our community for this organization. They give a lot of leadership and generosity and support to Hamot, and obviously have to be commended for the hard work that they do, just speaking on behalf of this organization every day. The hard work by Jim Orrin and Dave Zimmer and Lisa obviously doesn't go unnoticed, and Ann Beulah and I talk about that all the time as we continue to try to develop this foundation for the support of Hamot. The current campaign, obviously want to continue to thank them for their support for this, and it is a worthy cause. The Next Generation Fund supports health care, career exploration, and certainly will lead participants to future jobs at UPMC Hamot. The only thing I noticed was in that one picture, the one kid had the stethoscope on his cheeks. I think we need to make sure he pushes them up next time to make sure he actually hears something when he's examining. But nonetheless, our recent Corporator contributions have enabled enhancements to the Hamot Radiology Department with a new waiting room and our neonatal intensive care unit, where we take care of the sickest of the sick and the little ones that every day. Debbie has to remind me what the census is, but nonetheless, we do have a great support team that do take care of the little ones. In May of 2012, the New England Journal of Medicine published a perspective paper on the current state of healthcare titled, "What Business Are We In?" It warned physicians and hospitals not to get captured in a Kodak moment. Most of you who know the Kodak situation know that they were late to digital imaging and continue to focus on the production of film when its customers really wanted pictures. The film really wasn't that important. And ultimately, we know what happened to Kodak. As this applies to our industry, what people really want is health, not increasingly expensive and complex health care. Consumers want to be healthy, and when they are sick, they want their needs readily met, as evidenced by what the comments that you see regularly from our emergency room satisfaction surveys. The real issue is always the turnaround time. A transformation is currently underway that will work to eliminate healthcare's fee-for-service model while moving towards a more consumer or customer-oriented model. UPMC is describing this as a new normal for the delivery of healthcare. The new normal benefits all of us in that it supports value-based care and rewards providers like UPMC Hamot who offer high-quality and well-managed care. This new era also is characterized by lower government reimbursements, as Steve Danch always reminds us every single day and every minute of every day. The emergence of a super competitive insurance market with compressed rates, insurance companies ratcheting down utilization, thanks Boo Haggerty, forcing efficient care with better outcomes. Declining research funds from government sources continue to add to the equation. At UPMC and UPMC Hamot, we are challenging ourselves every day to stay ahead of that curve. We are developing new models of care that maintain our high-quality services and include a greater focus on coordinated care and population management, as well as chronic disease and wellness. Efficient hospital throughput, which we spend a lot of time on. That's getting you through that emergency room as quickly as possible and taking care of your inpatient needs as quickly as possible with positive outcomes. Minimally invasive treatment options with enhanced technology that we continue to invest in all the time. And I know that led by our clinical team, Jim Donnelly and David Gibbons and others, we continue to look for the most advanced technology to make the patient's experiences as positive as possible. We work on aging and end-of-life care, and that's a very important part of this. End-of-life care, I had a situation just the other day with a friend of mine who spent 21 days in the hospital in a dying situation, and it was very difficult for that patient's family to get around the palliative care intervention, but eventually with a lot of coaxing and a lot of education, a lot of continued instruction, the family were able to finally get to a point. And this is going to be a very part of our healthcare continuum in the future to manage that end-of-life situation where the majority of our healthcare dollars are being spent. In developing our new models, UPMC is finding new and innovative ways to leverage their economic scale, achieve more consistency and efficiencies, and lower our operating costs every day so that we provide for our patients in the highest quality and most efficient way. Leveraging the scale of the UPMC system has also provided UPMC Hamot with purchasing power and recently has enabled the organization to bolster its technology platform. We've added cutting-edge CT scans, an advanced surgical robot, basically the second version. We were one of the first hospitals in the country to get into the robotic surgery business, and we just advanced to our second version of that, and adding to greater MRI capabilities as well. Our ED, led by Dr. Fred Merarkey and his team, is among the busiest in the country with more than 80,000 patient visits a year. By implementing best practices and focusing closely on operations and our systems, our organization is improving our ED patient experience and more efficiently treating the patients. Because increasing numbers of patients do not meet admission criteria and they become designated as what the insurance companies have designated as observation status, under the direction of David Gibbons, our Chief Operating Officer, and Jim Donnelly, our Chief Quality and Nursing Officer, established a clinical decision unit on the third floor, which was our empty obstetrics unit, our old obstetrics unit, to better meet the needs of this growing patient population and reduce unnecessary hospital administration or admissions. UPMC is a leader in the deployment of electronic health records, and last September we made our complete conversion to that and remains focused on advancing smart technology and information systems. UPMC also continues to aggressively invest in smart science, research, and partner with new market innovators like GE and IBM. We recently implemented a new documentation system and scheduling platform, clinical decision support, and new picture archiving of all the images. Now physicians at Hamot have greater access to a full range of patient information no matter where they are, at home, in their car, at work, wherever. This significant accomplishment is another example of how the UPMC affiliation has enabled us to leverage our scale and very expensive technology in support of our patient care initiatives. With more than 3,200 employed physicians, 20 hospitals, and a myriad of community-based facilities and outpatient programs, UPMC is a top academic medical institution and leading provider of healthcare services in Western Pennsylvania. UPMC is also expanding its footprint and soon will complete an affiliation with the Altoona Regional Medical Center in Altoona, Pennsylvania, sometime this summer. As a financially strong, integrated delivery and finance system, UPMC's front-end business, the UPMC Health Plan, is also gaining market share. As value-based demands alter insurer-provider relationships to drive cost savings, payers are steering patients to lower-cost services and establishing narrow networks that limit provider options. As an IDFS, an integrated delivery and finance system, UPMC and UPMC Hamot have industry, clinical, and scientific expertise to serve as the leader in the provision of value-based health care and insurance services for years to come in our market. I would now like to provide a bit of perspective on the increasingly competitive provider and insurance market regionally, and specifically touch on Highmark's recent acquisition of St. Vincent's and the introduction of the Allegheny Health Network. That is comprised of West Penn Allegheny, Jefferson Regional Medical Center, and here St. Vincent Health System in Erie. UPMC and UPMC Hamot advocate for choice and competition and look forward to competing with this new network. UPMC's contract with Highmark expires on December 31st of 2014. And Highmark's plan through that is to entice thousands of patients away from UPMC and UPMC Hamot to their affiliated hospitals. When UPMC and UPMC Hamot came together in February of 2011, you remember that UPMC committed $300 million to the investment in this organization and became responsible for our pension and all of our debt and liability, which made Steve Dance, again, very, very happy. The guidance of our board, though, over the past 2 years has been instrumental and has resulted in the following. More patients are remaining in Erie, accessing higher levels of specialized care right here at Hamot. New specialty clinics have been opened in areas of pediatrics with our friends at Shriners Hospital, and women's services. We've recently added services for transplant patients here, where now we have a transplant clinic here in Erie, so patients after can either pre or post-operatively see physicians in Erie instead of having traveled to Pittsburgh for that care after they've had their transplant. UPMC Hamot continues to grow as a destination for health care, with record numbers of patients traveling to Erie now, up 8% year on year. Our regional partnerships and strategies have expanded and have been strengthened this past year. We spend a considerable amount of time with our regional partners in the many counties that I know that Jim had mentioned earlier, who are looking for partnerships to be expanded and growing, not only on the hospital side, but on the physician side as well. And our team here, along with Gary Maris, Val Jackson, myself, and others, Steve Danch, who've spent a considerable amount of time on the road developing and nurturing those partnerships, those will continue to grow as well. Physician recruitment, now led by our VP of Physician Services, Lynn Rupp, remains a top priority for the organization. UPMC Hamot boasts the region's largest primary care and specialty network in the region, and along with top programs in cardiac, neuroscience, trauma, orthopedics, cancer, and women's services, continues to outpace the rest. UPMC hospitals are community assets that serve as employers and stakeholders, and most importantly, as partners building healthy communities and offering world-class health care for all of our citizens in this market. So now we're going to show a video. Hopefully you enjoy it. Hopefully this will encapsulate some of the things that we talked about. You'll see interviews from different people in the organization that get to speak a little bit more openly about these advancements and opportunities that we've talked about in the last couple of minutes. So please enjoy the video, and thank you for your support.
For decades, UPMC Hamot has led the way, foreseeing the challenges that lie ahead and making the necessary decisions and critical investments to remain a leader. But most importantly, to continue to bring the highest level of healthcare to the families of our region.
Well, clearly, I think everything that we predicted before the affiliation is becoming an increasing challenge. We are facing unprecedented payment cuts, payer mix changes, and reduced resources that we're able to deal with. So the affiliation with UPMC, and now that we're 2 years in, is a tremendous value.
We've now been entrenched in the last few years in declining reimbursements, restructuring for access, a focus on quality, a focus on incentives based on those qualities as well to make sure that you can maintain a high level of positive patient outcomes.
But make no doubt about it, payment cuts are going to continue. This is going to be the new normal. We have to become more efficient. We have to leverage the scale. We have to have standard systems that enable us to take that efficiency to the maximum. And again, as we said before, maximize those resources that go to patient care.
Every day we turn around, something new is happening, from federally to locally, and we're really trying to adjust to make sure we're meeting the community's needs.
First and foremost, we look at patient safety and quality. That is our primary driver of what we do every day. Secondly, we invest a lot of time into staff development. Also, we've invested a great deal of effort into our capital acquisition through equipment, refurbishing our buildings. We have a $300 million investment provided by UPMC, and that really is our driver behind what we do every day to position UPMC Hamot into the future.
The basis for the integration with UPMC was always to keep people locally, create a Northwest tertiary hub for UPMC, and advance these specialties that were here. In the last year, we've seen an 8% increase in the patients who actually stayed local to advance their care here at Hamot. And so I'm pleased to say that I think the whole process has worked, and we're continuing to advance Hamot as a tertiary hub for UPMC in the northwestern Pennsylvania markets.
UPMC Hamot is growing its physician network by adding specialists to the area, in addition primary care, so that we have the access that is unprecedented to every level of care that you need, from preventative through emergent care.
Because of our ties to the University of Pittsburgh Medical Center, we have access to a lot of their practitioners, and we have some of their practitioners come here and spend a day or two a week and see patients here, rather than having patients going down to Pittsburgh.
The ability for Hamot to bring specialists here, recruit specialists here to Hamot, make it attractive for physicians and those hospitals to refer patients here has obviously been our goal.
UPMC Hamot has advanced our breast imaging services beyond an unparalleled service prior. You can get results and follow-up studies, and then even a biopsy, all in the same day, at one of the most nerve-wracking times when you've received a report that there's something wrong. And those words stick in your head and you can't think of anything else. From beginning to end, that time of wait is as minimal as possible. You have all the answers and all the information that you need before you ever leave the door.
Transcatheter aortic valve replacement is replacing the aortic valve, which is the main valve that lets blood out of the heart, through the leg, or another approach is through a small hole in the chest, but presently we're doing it through the leg arteries. It's a really exciting technology because aortic stenosis, or narrowing of the aortic valve, is a very common problem, especially in the elderly, and many of these elderly patients are too high risk to undergo the conventional operation, i.e. open the chest and be on the heart-lung machine. This is really an amazing procedure, and the awesome part of this procedure is it's a team approach, okay? And we have so much expertise in the room at one time. It's really benefits the patient tremendously.
We have been able to add a level of pediatric care here in the area through pediatric specialty clinics currently located at the Shriners Hospital. Now we have a full service complement of pediatric neurology, pediatric neurosurgery, pediatric GI, offered locally at a level of service that you could only previously leave town for. Many of those are chronic conditions that you would repeatedly make trips out of town, which hurt families, communities, children having to leave school repeatedly.
Robotic surgery is becoming much more popular and is being used across many specialties now. And the use of the Da Vinci robot has increased dramatically here. And we see, almost every day we see surgeons using the Da Vinci device to go ahead and do laparoscopic procedures with. All the new technology that we have available to patients allows a cutting-edge medicine to be practiced here at UPMC Hamot.
At a time in a person's life when they're needing to access transplant services, it's a very stressful time for the family, and it is a very difficult procedure to recover from as it is. And then now allowing us to do your follow-up care, your pre-procedural care here locally, and ensure that the highest level of quality and a seamless continuum is always provided.
Well, we've showed over the years that we've been a quality provider, and obviously our recognitions and the things that, the acknowledgments that we've had, not only from the external bodies, but also from the community, have been proven that Hamot has been there for patients when they've been needed. And I think that there's no question that the access to our services will continue to be important for patients in the community and the region as we continue to develop the high-level tertiary care services that the community needs and wants.
We will continue to be focused on quality, and that is our #1 job relative to delivering quality patient care. And we think if in fact your employer has Hamot in their insurance choices, that more people will choose Hamot based upon that quality reputation.
Thank you, Jim, and great job to the leaders and physicians featured in this video. Now I hope that all of you will join us at the reception that will take place in the designated areas behind us after the meeting today. Seeing that there's no other business, I would like to ask for a motion to adjourn. Do I have a motion? Do I have a second? Second? All in favor? Okay, thank you so much for coming today. The meeting is now adjourned. Have a great day.